How do astronauts overcome space adaptation syndrome? Imagine stepping into space for the first time and feeling dizzy or nauseous just because your body is confused about what's happening. That's what astronauts face with space adaptation syndrome. It affects many astronauts during the first days in microgravity. This happens because the inner ear, which helps us sense balance, gets mixed signals with what the eyes see. The result can be dizziness, headaches, nausea, and disorientation. But astronauts don't just suffer through it. They prepare and manage these symptoms with smart strategies. Before a mission, astronauts go through special training. They experience simulated microgravity in planes that fly in parabolic arcs, making them feel weightless for short periods. They also use virtual reality exercises to help their brains get used to sensory conflicts. This pre-flight training helps their brains start adjusting before they even leave Earth. Once in space, symptoms usually peak within the first 1 or 2 days. But the body begins to adapt quickly, and most astronauts notice symptoms fading within 2 to 3 days. During this time, they avoid strenuous tasks and focus on simple activities. Medications like promethazine or scopolamine are often used to reduce nausea and dizziness. These drugs help manage symptoms but must be used carefully because they can cause drowsiness. Astronauts are also trained to control their head and body movements carefully. Focusing on stable visual cues inside the spacecraft helps reduce disorientation. They learn to avoid sudden motions and keep their orientation steady. Exercises that improve balance and coordination are part of their physical and mental conditioning. These help the brain better process conflicting signals from the inner ear and eyes. During the mission, crew members monitor each other's symptoms closely. If someone feels too unwell, they might postpone activities like spacewalks or critical experiments until they feel better. After returning to Earth, astronauts often experience a reverse version of space adaptation syndrome as their bodies readjust to gravity. They go through rehabilitation programs that include balance exercises, physical therapy, and muscle strengthening. All these steps, training, medication, operational strategies, and post-flight recovery, work together to help astronauts overcome the initial challenges of space travel. This careful preparation allows them to stay safe and perform their tasks effectively during those critical first days in space.